Is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining today's webinar, Happy Campers in the Now Normal Camp COVID-19 Testing, Why, Who, and How. Our speakers today are Karen Gerwitz and Travis Wilkes. I'm Genevieve Randall, and I'll be the moderator for today's webinar. Before we begin, I'll let you know a little bit about how this webinar will run. So this webinar is being recorded, and you'll receive a copy of the slides and the recording via email within 3 business days after the webinar. A Q&A session with the speakers will follow the presentation. During that time, you can submit questions using the GoToWebinar sidebar menu. Click the Questions tab, type in your question, and hit Enter on your keyboard. You can ask questions throughout the presentation and during the Q&A session itself. Now I'm going to pass the webinar on to our speakers. Thank you.
Thanks, Genevieve. So I am Travis Wilkes. I am the Medical Director of empowerDX and Eurofins Safer at Work.
Hi, everyone. I'm Karen Gerwitz. Thank you, Genevieve and Travis. I'm Business Development Director for our Safer at Work program. And with this, we can move on to the next slide. Okay, so why Eurofins? We want to all explore together again. We're a global life science company that has been on the forefront of COVID testing since day one. We launched our first PCR test on March 13th of 2020. And to date, we have run over 24 million COVID-19 tests. We guarantee a 24-hour turnaround time. We have 12 laboratories across the US with a CLIA license for COVID-19 testing. And we have 50 laboratories with this accreditation globally. We have 30 years of experience in infectious disease testing, and our weekly capacity for COVID-19 testing is 500,000 specimens. So now we're testing for negative. This is the now normal. This has been changing very rapidly, and at this point, we need to keep our spaces negative. We all see the light at the end of the tunnel, but we're not out of the woods yet. We must continue to be diligent, protect our children, loved ones, our camp teams and staff, and our communities. We provide a wide range of testing options that can provide a safety net as we move through this new phase of the pandemic. So we're sick of testing. It's tiring. We feel like we're there. It's still important, and Dr. Wilkes will explain more in a bit. But we need to ensure our spaces and herd immunity has been a term that's been around repeatedly, and it's thought that we will achieve this with COVID-19. And as things have evolved, scientists have determined it's not a goal that's likely to be met, at least anytime soon. This is with vaccination resistance, variants emerging, and younger populations not being able to be vaccinated. With that, our goal really is to have negative spaces to have that confidence. So it's important to monitor early detection, and this can significantly mitigate risk. And this will also give our scientists time to combat the variants that are emerging, prove vaccine longevity, and improve preventative medicine. So what are the continued risks? We don't know how long the current vaccines will be effective. Right now, unfortunately, the US vaccine rate is stalled. Only about 39% of the population is fully vaccinated, and this leaves room for vulnerability we also have variants of concern continue to emerge. And at this point, it's not thought that children under the age of 10 will have access to a vaccine until next year. The vaccine is under emergency use only at this point, and it was developed very rapidly. That's why it's for emergency use only. And they are working on the approval for children, the longevity, and covering variants, but we need to give this some time to be where it needs to be. So Eurofins, we are uniquely qualified. We partner with camps and schools. We want to continue to protect our most valuable assets in our future, which are our children. We have testing strategies that are designed to anticipate real-world daily camp activities to protect us from potential transmission in current and ongoing conditions. We're very customized, we're nimble, we can provide solutions tailored to fit each unique situation. Our turnaround time for testing, you can't beat, and our customer service and our nimbleness and agility to switch gears as things change, which they will. And where our whole model is to partner with you. Okay. So what can we expect? Well, we can expect the unexpected. And that's basically what we've been doing for the last 18 months. I think my slide just moved forward on me. Yep. Back. That's okay. We'll just talk on this slide. It may have frozen a bit. In any case, oh, here we go. Okay, this is really delayed. Sorry about that. So looking at 3 different camp scenarios, one being primarily outdoors, such as like an equestrian camp. Another being primarily indoors, such as a basketball camp, and then a hybrid, such as a community center camp. No company is better prepared to pivot on testing response and can partner with other vendors as well, such as telehealth, getting people on site to do testing, different types of tests between antigen, pooling, and PCR, environmental, to really give you unparalleled network and success. We want to thrive together. We all want to see us and our kids return to thriving. Camps are very important. They're an invaluable piece of children's development. However, the risk is still real. It's not going away, and it is a threat. So we have to manage that appropriately. But the good news is we can plan for just about any logistical scenario. We can remain vigilant, and we can act fast. So we can help nearly any individual, any organization, in virtually any industry. So to kind of wrap this up, we could do people testing, which is the RT-PCR, or the gold standard that you hear talked about. We do antigen testing, which is the rapid 15-minute testing. We can do quantitative antibody testing to really get a gauge on those who have been previously infected and or those who are vaccinated, how long and what the antibody level is for them. And we can also offer pooled sampling. On the early detection side, there are several studies showing that early detection using environmental monitoring is a great resource. So we can offer wastewater testing, high contact surface area testing, and indoor air, and even worn disposable mask testing. We can provide support, whether it be training, certification of a site, process audits, etc.
So, oh, sorry.
I apologize, Dr. Wilkes, but the slides are a little slow. One last thing before we get to the real expert here is we do have an at-home testing kit, which does not require a medical professional to administer. It does not need a prescription. It's easy. In most cases, insurance will cover it. Just recently, it was approved under the EUA, or Emergency Use Authorization, by the FDA for ages 3 and up. So this would be a great tool for at-home testing, both before you allow campers, including staff, to come into the camp and into your bubble, and also after they leave to make sure or validate that they did not get COVID-19 while at camp. And with that, I will pass it on to Travis.
Thanks, Karen. So let's talk a little bit about how pooled PCR testing works. So pooled PCR testing, some people have heard about, a lot of people haven't. So it is this idea of sort of creating a powerful, cost-effective tool by collecting between 5 and 24 individual samples by nose swab. So just traditional, simple nose swab. No pain involved or anything, and then pooling them together and running a single PCR test on the one sample pool. And then if that test comes back negative, then we know that all the people in that pool were negative for COVID-19. But if it comes back positive, then we know that someone in the pool or multiple people have COVID-19, and we need to individually test them. But especially in a situation where you sort of expect for the majority of people to be negative, which is, I'm sure everybody who's attending this has the expectation and optimism that the test will be negative, and hopefully they will be. Then it works out great, and then you really limit the number of individual tests, which can be a really cost-effective tool, but still providing really high-quality diagnostics. So I think we're having slide delay.
There we go. Okay. So the goal now, did we miss a slide for you, Travis?
Yeah, there's another slide in there. It's basically what we just talked about, though. The advantage is that the pool testing gives us this cost-effective but yet very robust solution. So it eliminates daily individual PCR testing, which is great, but becomes really expensive, especially when you expect for most of the tests to be negative. And it helps identify asymptomatic, pre-symptomatic, and minimally symptomatic people who could be carriers of the virus, but not necessarily presenting in ways where they would be detected by symptomatic screening. There are automatic retesting options if positives are detected, and turnaround times are relatively quick. So they don't equal rapid antigen testing, but in terms of PCR testing, they are very quick.
Okay, thank you. So the goal now is testing for negative. You need a safety net to ensure COVID-19 free spaces. So what we really want to help you do is protect the people that you've promised to keep safe. We want to limit your liability and protect your brand image. Nobody wants to be that camp that let a positive cause an outbreak when we're all trying so hard to get back to normal. And you need to build and retain the trust of the parents, families, campers, your staff, and your community. So with that, we have several questions that have been asked recently, and Dr. Wilkes, if you could kind of go through some of these, I think we're anxious to hear some of these answers.
Travis, I can pose these to you, and then we'll go through some answers to get for our audience. Okay, our first question, great. Frequently asked question about camper COVID control is which layers of COVID-19 kind of prevention and protocols are most important? Is it the 3 to 6 foot social distancing, mask wearing, testing, everyone getting vaccinated?
Yeah, this question comes up a lot. Everybody wants the magic bullet, which is tough. So the way I think about this is that everything is important. So every step that you take has a purpose and can be meaningful. The important way I think to look at this is that we have fixed variables and then dynamic variables. So the benefit of social distancing and masks and vaccinations are all fixed variables, meaning that once they're in place, they're really hard to they're really hard to change the benefit. So you know, if one of these factors decreases someone from spreading it from 1 person to 3 people instead of spreading it to 5 people, that's great, but it's still kind of that fixed variable. Where testing comes in is that testing is a dynamic variable. You know, what I mean by that is that the more you test, then the more likely you are to find people who are positive very early, and then prevent them from spreading to other people, whether they're symptomatic or not. And I think that's a really important thing to sort of consider is what's a fixed variable, what's a dynamic variable. Lay out your fixed variables and try to make those as comprehensive in terms of policy and all as possible, and then figure out how you introduce testing as a dynamic variable to really drive down the cases and ensure that ensure negativity in the population and prevent an outbreak.
Okay, thank you. So another question is, so suppose you are doing PCR testing of symptomatic campers at your camp. How do you handle a camper that is symptomatic before you get their test results confirming or otherwise that they are positive for COVID? Is it safe to quarantine them at camp? Do they need to go home immediately? Can vaccinated staff safely interact with them, and how would they do that?
Yeah, I think this is where sort of preparation and planning and developing policies is really important because you really do have to be prepared for these situations. One important thing to realize is that if someone's symptomatic, it's important to isolate them, because people who could have COVID or have COVID need to be isolated rather than quarantined. And the CDC has some nuanced variability between what is quarantine versus isolation, but they really do need to be immediately separated from the rest of the population, placed in an area where they're not in contact with other people and not likely to spread the virus to other people. Important considerations in these sort of things is ventilation. You know, how are they going to have access to a restroom? How are they going to get food delivered to them and things like that? And so I think that then it becomes important to have a PPE protocol for even vaccinated people. There should be, you know, there needs to be mask wearing when interacting and attempting to social distance. Obviously, if emergency care is needed, then you by medical staff or something, then you provide that by using PPE as necessary. But I think just having that protocol in place for where are you going to isolate them, how are you going to isolate them, what does that isolation look like, and does it provide them with everything they need during that period?
Okay, excellent. Thank you. Okay, so our next question is, what's the ideal number of campers in a cohort? School recommendations say up to 30, but that seems like a lot. Can you talk a little bit about cohorts?
Yeah, I think one thing to think about here is to try to identify your goal. You know, as long as you are minimizing, I mean, whatever you can do to minimize the number of people who interact with each other will drive down the chance that of an outbreak, basically. And that's just sort of logical. I think that another element that's important to apply here, though, and thinking about how to group people together in cohorts, is thinking about pool testing, because currently we can do pool testing between 5 and 24 people. If you have a pool up to, say, 24 people, then they can all be included in one pool test, which would result in pretty significant cost-saving advantages. So I think that one side, you have to sort of think about, okay, how are we going to mitigate risk of interaction, and how important is that in the overall population, and what's possible in this in that local environment. And then the other thing is to look at testing strategies and looking at, you know, is pooling the best option for your facility, and if so, then you know, then organizing under 24 so that we can accommodate those people in a single pool.
All right, thank you. Our next question is, now that older kids can be vaccinated before they go to camp, how does that change their ability to unmask or decrease social distancing protocols?
So we are all kind of operating under CDC guidelines. As of right now, it does not change the CDC guidelines. The CDC has put out bulletins to revise guidelines many times throughout COVID, and I think that may happen. But I think that we sort of have to think right now that things will not change, and then be sort of pleasantly surprised when new guidelines are put into place by the CDC.
Okay, great. So our next question in regards to campers is, if kids and or staff must wear masks most of the day, how often do they need to change them? Daily, twice a day, every other day, just when they get dirty?
Yeah, I think this is. I think that this depends on if you're doing paper or cloth masks. I think if you're doing a cloth mask, then you sort of treat it like any type of clothes, so underwear, socks. So you know, you kind of wash them as hygienically necessary. If you're having paper masks, it sort of largely probably depends on how long the paper lasts. I imagine that with an active kid who's running around, a paper mask isn't going to last very long. But I would just think about the cloth masks exactly how you think of socks and underwear.
Okay, yeah, that's a useful kind of guideline. Thank you. So now we're going to move over to frequently asked questions about camp staff. So first, how often should we test our unvaccinated and vaccinated staff?
Yeah, so I think it's really important when you're developing these procedures and policies to really know your numbers up front, and to understand what percentage of staff is vaccinated and what percentage is unvaccinated. I think that will help kind of drive procedural policy. I think that in the best case scenario, with unvaccinated staff, would be testing daily, just to truly ensure safety, whether that's a daily antigen test or a daily pooled PCR test. That way we could really prevent an outbreak and catch things as soon as possible if they do arise. I think that's sort of an individual planning decision, though, about which way to go between PCR, pooled PCR, and antigen testing. I also think though that it's definitely important that you do a PCR test prior to arrival. I think that is extremely important, because you do not want to bring someone in who could be potentially introducing the virus on their first day into the facility. I think that our empowerDX kit has a rapid turnaround, so we could you could get them to test 3 days before and get a result back before they walk onto the campus. But I think that we can, with individual groups, we can definitely kind of expand this conversation and kind of look at vaccination and unvaccinated rates, and really come up with the most ideal testing regimen. I also think that another thing to think about is some of the environmental testing that we can do that could also help with early detection, especially of the unvaccinated population. Surface testing and wastewater testing are well in our wheelhouse, and we could discuss those as well as sort of an added layer in monitoring and surveillance.
Great, thank you. Okay, another question. How do we handle staff leaving camp for off days?
Yeah, so I think that I think that is probably a necessary thing. I don't think that it's possible to lock people up for an entire summer onto a campus and make them stay. So I think you have to sort of look at your risks, develop a risk tolerance, and then figure out how you mitigate the risks. And testing, being the most dynamic variable, helps kind of mitigate these kind of risks. You could, if you already have a daily testing protocol, then that's going to work fabulously, and you probably don't need to do anything different. If you're not having a daily testing protocol, then doing some sort of testing protocol after someone has been off campus, possibly testing on day 2, 3, and then day 5. Or some variation. I mean, it could be flexible depending on the exact situation that gets set up, but some sort of way to mitigate that risk, because that is definitely a risk. So anytime someone's going to leave and potentially get exposed to a different population, then bring back something potentially from that population to this, this camp population, there's definitely the potential that they could bring COVID back with them. And so there has to be that mitigation effort.
Great, thank you. Okay, our next question is taking temperatures daily a good check for COVID-19?
Yeah, I don't think so. I think that temperatures, especially in kids, and especially in people who've been vaccinated, who are more likely to be asymptomatic, is not likely to yield much in terms of being a good sort of sentinel for detecting COVID. Kids are often minimally symptomatic or asymptomatic, and as are vaccinated people, when they get infected, they're also usually minimally symptomatic or asymptomatic, and that includes not having a fever. And so I think that the temperature checks, which were enacted very early on last year in COVID, as sort of an attempt to start doing something, have really lost their utility. And I think that they sort of stick around more as a historical thing, that's what we've been doing during the COVID pandemic, more than as a useful tool. So generally, in most testing protocols, or most mitigation protocols, I think that they have much less use than better options like pool testing and environmental testing that we offer.
All right, thank you. Our next question, how do we manage contact tracing if we have poor reception in the area? And this is in regards to like those contact tracing apps or monitors.
Yeah, so I don't see them as being particularly useful in this situation. I think that you have to kind of prioritize what is going to be what are your sentinels going to be, what's going to be the most useful tools, and I don't see contact tracing as a very useful tool in this setting, largely because it's a generally fixed group of people. There's a lot of sort of intermingling and interactions that can happen. I sort of expect that ventilation will be difficult to understand and manage. And now there's evidence that suggests, and some guidelines that suggest, that the virus can travel more than 6 feet indoors, especially in areas where ventilation is not as good. And so when you take it as a whole and you look at benefits of contact tracing in this environment versus other detection methods, I think that contact tracing should be deprioritized. It works a lot better in the setting of a restaurant, where really busy restaurant, where one person has COVID and they're sitting in the room, and you don't know who all was in that room, and there's not a good way to contact them. But if they had their app turned on and they could see, wait, I was around someone for 2.5 hours who had COVID and I was 6 feet away from them, that is useful. But that's just not the setting of a camp. And so I think that that it's important to really consider the camp environment and what is the best detection method in that environment.
All right, thank you. Another question, what is essential PPE when supervising a positive camper until they can go home? What about campers who flew into our camp from out of state?
Yeah, so this is again where I think policy and having a procedure in place becomes really important. So essential PPE, definitely you would want the camper to wear a mask. You would want anyone who has to interact with them to wear a mask. If N95s are available, it may be better for anyone who's interacting with them from a staff perspective to have N95 masks. I think that, and definitely social distancing. So no one should get closer to them, and that gets back to the previous question about sort of having an isolation protocol and space reserved for isolation if that's needed. In terms of campers who fly in from out of state, I think that this is where it gets really important to try to minimize this risk as much as possible. And I think pre-testing really helps. So pre-travel testing, I think, is really powerful. If you require pre-travel testing where someone gets a test, let's say 3 days before arrival at the camp, then you can kind of ensure that they don't arrive there and then test positive, which I think is the worst case scenario. I think that if a camper gets COVID while they're at camp and they're in isolation, and then you're trying to figure out what to do during the 10-day period, I think that that needs to be sort of laid out up front with parents, and what's the expectation going to be? What can your facility accommodate? There's a lot of things that I think have to be sort of worked out and mitigated within that. But I think that the most powerful tool to prevent that is going to be pre-camp testing with our PCR kit, which as long as someone's over 3, they're eligible for it. It's at home, it's easy, and it's non-painful.
All right, thank you. Okay, how often is enough for hand washing or sanitizing hands for staff and for campers?
I think this is tough. I think that I don't know if there's a right answer to a number on this one. I think that it is important that you sort of set up reminders for hand washing, especially in areas where people are going to be interacting with each other sort of directly, or in places where food is, cafeterias, high touch areas. I think this is tough because in the camp environment, there's kind of infinite variety of activities, and so I think setting up hand washing stations with the sort of hand sanitizer and that sort of thing, and then sort of creating a culture of sanitizing frequently is kind of the key. I don't know if this is different during COVID as during a non-COVID period. I think that you definitely want to encourage hand washing before eating. You want to encourage hand washing in the restroom, and then any type of kind of highly interactive area. And I think that one thing that's important is that if you can kind of identify these areas as being high interaction areas or high touch areas, then that opens the door for other testing possibilities as well for the environment.
All right, thank you. Okay, the last of our FAQ before we get to audience questions is, do you have hints on highest touch locations that need to be cleaned more often? What would be like the frequency of cleaning those locations? They're true dangers since new guidelines are focusing less on surface contamination issues.
Yeah, I think that areas should be cleaned often, but I think areas should be cleaned often in general, high touch areas. So, door handles and restrooms, cafeterias, like I was just talking about. I think though that while the danger of going and touching something, a surface, and getting COVID from touching that surface looks like that is relatively low, the risk of a surface getting contaminated by SARS-CoV-2, the virus that causes COVID, and being detectable on that surface is high. And so what I mean by that is that if you're thinking about it from a environmental monitoring standpoint, if you can identify these high touch areas, that would set us up for surface testing where we could kind of swab those areas and identify that you've identified as being high touch, and those would be really good as a sentinel for environmental monitoring. So I would say, in a nutshell, identify these areas, clean them frequently, and have a plan, perhaps if it's part of your mitigation strategy, to test those surfaces before you clean them, so that way we can more rapidly identify if there's SARS-CoV-2 in your environment and therefore help prevent a COVID-19 outbreak.
Excellent. Okay, thank you. So now we are going to move into the Q&A, but before we do, I have one polling question for the audience. And that polling question is, do you want a representative from Eurofins to reach out to you regarding services covered in this webinar? The question should be on your screen now, so select your answer and we will then move into Q&A. If you can't select an answer for whatever reason, but you want to respond, you can just put your answer into the questions chat or the chat box, and we'll get back to you. So while I'm waiting for responses to come in, so I want to remind the audience that you will receive a recording and copy of the slides from today's webinar. You'll get that via email within 3 business days. Right, and now I'm going to close the polling question and we'll go into Q&A. Okay, so to submit a question to our speakers, use the GoToWebinar sidebar menu and select the Questions tab, type in your question, then hit Enter on your keyboard to submit. Any questions that we don't get to during this webinar session, we'll follow up with you to get an answer for you. Okay, and so our first audience question is, does pooled testing come in a kit?
Do you want to take that, Karen?
Sure, yes, I can take that. The pooled testing does come in a kit. It is a PCR test, and as Travis had mentioned, you can pool up to 24, and what we can do is include reflex. And so what that entails is each camper, including staff, will swab using 2 different swabs, and one swab is put into the pool and a second one is labeled with that individual camper's information and set aside. In the event that the pool is positive, then automatically we will go back and test each of the swabs individually to determine who within that pool is positive, to take care of the proper quarantine/isolation needs.
All right, thank you, Karen. Our next question is, what kind of test would you recommend for a daily testing program?
Yeah, so I think it depends on how you want to set things up. I think that there's different options. I think that daily antigen has advantages, as does pooled PCR. I guess it comes down to sort of a comprehensive look at and at cost and what overall works best for that environment. When we get into daily testing, I think that they're both good options. It's just more of a matter of what's more appealing. The advantage, you get a result very quickly, and the advantage of pooled PCR testing is it's a more sensitive test. It takes more time, but it may be more cost effective since it's pooling all the testing together.
All right, thank you. Okay, so our next question is, do variables like indoor versus outdoor, age of campers, number of campers, affect testing protocols, and if so, how?
I think so. I think you get into some nuance of risk, and I think that you can look at everything from age to numbers to indoor versus outdoor. I think all those are very real variables. I think that one of the biggest variable that doesn't get mentioned is this, but it is an important variable, is budget for testing. And I think you have to sort of make everything fit into that. I think that's kind of an important consideration, because I think that you can make the most wonderful testing protocol, but it has to actually be affordable and it has to be actionable. So I think that probably has to come up on an individual kind of strategy discussion. I could see a lot of different possibilities, but I think that there's no scenario. I mean, I think in every scenario we could find sort of a cost-effective strategy that really helps mitigate risk and make the camp safer.
Thank you. Okay, we have another question. Is there a difference in COVID safety measures for day camps versus sleepaway camps?
I think that it gets into, I want to say yes and no. I mean, in one way, you've got people who are leaving the environment every day, and they are, they're going home, they're interacting with other people who may or may not be vaccinated. So there's a lot of sort of downstream variability that happens in that in a day camp versus a sleepaway camp, where if you PCR test a kid beforehand and you're confident that they're coming into camp with COVID negative, then I think that you can feel a little bit more secure in a sleepaway camp. Just because if we do pre-camp testing with PCR at a day camp, they could easily acquire it outside of the camp when they go home every day. So I think that it probably in day camps, I would probably push a little harder to encourage a daily testing protocol. I think that a lot of it depends too, though, on then looking at the individual variables and looking at what's the overall comprehensive mitigation approach. So are we doing environmental testing, or what are we looking at, and how can we best approach that? So I would say there are definitely differences. Sleepaway camp has less variables and is probably easier to design a program for, but we could easily come up with a strong program for a day camp. It would probably just need to include a more high intensity testing.
Great, thank you. Okay, another question. If campers have to get tested before they come to camp, what should that timeline look like? How close to camp start should their test be?
So we've looked at this a lot. So there's a couple different strategies, and I think that this is sort of an individual camp director discussion too. So if your goal is to maximize participation, meaning you don't want to exclude anybody, what you'd want to do is to test everybody at least 14 days, or at 14 days before camp starts, and then again at 3 days beforehand. And the rationale for that is that we know that PCR testing is very sensitive, and it can be persistently positive, meaning that you could have had COVID up to 90 days ago and continue to test positive for COVID. And so you would not, if the goal is to maximize participation, you don't want to exclude someone who had COVID 2 months ago, maybe even asymptomatically, and they're positive 3 days before camp. If you follow that procedure for maximum participation, what it allows you to do, you test them 14 days beforehand. If they're positive, then by the time that they come to camp, they will have met CDC time-based guidelines for no longer being contagious. And if they're negative at 14 days, then you can be confident that they're not going to be persistently positive. And then you test them again at 3 days before camp, and then you are confident that they're not coming into camp negative. They're not coming into camp positive for COVID. So that's to maximize participation. If you are more comfortable excluding people, or potentially excluding people who are persistently positive, then you could do testing just 3 days before camp. However, it is much more likely that kids who are persistently positive will be excluded, even though they won't be contagious and they won't be carriers of the virus then. And we have a lot more literature on that that we can provide, because that has been a big focus of a lot of different programs that we've done outside of the camp environment.
All right, thank you. Yeah, that's a great question, and we do actually have an infographic available that is about testing program options, and it lines out some of that timeline kind of based logistical problem. So I'm going to send that actually to our full audience right now, just a link to where that lives on our website. I'll also make sure to include this in the follow-up email after this webinar that includes the slides, just so you have that on hand and for reference too. Okay, I believe that we have one last question. Okay, how do I collect samples for at-camp testing?
Karen, do you want me to take that?
Oh, or I can take it.
I wasn't sure. Yeah, go ahead if you want to take it. Go. I can let you have that one if you want.
Okay, sure. So depending on what test you choose, in most cases we would recommend the nasal swab versus a nasal pharyngeal. Dr. Wilkes mentioned several times it's pain-free, it's painless, and so we want to be sensitive to that and want to get acceptance. So the test can be done nasally versus nasal pharyngeal. We also do have a saliva test that could be for pooling, and we can talk through the pros and cons with nasal and the pooled saliva. But for all cases, whether it be PCR, antigen, individual, or pooled, it would likely be the nasal swabbing. And it's basically in both nostrils, about three spins around in each. And campers can either do the swabbing themselves with the oversight from a medical professional being on site, or a medical professional like the camp nurse or somebody could administer it for them. And again, depending on the test type, would depend on how you process the sample from there. If it would be PCR, then you would we provide all of the FedEx prepaid envelopes to ship it back to the testing location overnight. If it's an on-site antigen, the 15-minute rapid test, it would be typically depending on which one we would use, and we could talk through all that, but you would use the medical professional or the staff would use a reagent, put 6 drops on a card, put the swab in, turn it, I think 3 to 5 times, close the card, put the time on it to know to check it in 15 minutes, and it's very easy to read. And I hope that answers the question. If you're looking for other details or something else, definitely let me know and I can work with you one-on-one.
All right, thank you, Karen. And if you do want to reach out and learn more about either testing methods, modalities, anything regarding COVID control at your camp, or other services talked about in this webinar, you can reach out directly to Karen. Her contact information is on the screen. You can also visit our website to learn more. That wraps it up for our Q&A session and for today's webinar. I want to remind everyone one last time that you will receive the recording and the slides via email after the webinar, and that will be early next week. Thank you all for joining today, and thank you to our speakers for your time.
Thank you, Genevieve. Thank you, attendees, and have a great holiday weekend.
Thanks. Bye.